Question 1. Analysis of a situation where a patient requires a complex and expensive medical treatment, but their ability to adhere to post-treatment care and benefit from the intervention is significantly hindered by unstable housing, lack of reliable transportation, and limited social support. The healthcare team is debating whether to proceed with the treatment given these social factors, which are recognized as significant social determinants of health. Which of the following approaches best aligns with the principles of health economics and equitable healthcare delivery in this context? Option A. Advocate for the patient by actively working to address the identified social determinants of health through community resource referrals and collaborative care planning, while proceeding with the treatment once these barriers are mitigated. Option B. Proceed with the treatment as medically indicated, assuming the patient will find ways to manage their social challenges independently. Option C. Deny the proposed treatment due to the patient's current social circumstances, deeming them too high a risk for treatment failure. Option D. Focus solely on the clinical necessity of the treatment, disregarding the patient's social situation as outside the scope of medical decision-making. Correct answer is A. Advocate for the patient by actively working to address the identified social determinants of health through community resource referrals and collaborative care planning, while proceeding with the treatment once these barriers are mitigated. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of a patient with broader societal and economic considerations, all within the framework of healthcare economics and policy. The challenge lies in determining the most equitable and effective allocation of limited resources when social determinants of health significantly impact a patient's ability to benefit from a particular intervention. Careful judgment is required to avoid discriminatory practices while acknowledging the systemic barriers that exist. Correct approach involves advocating for the patient by identifying and addressing the social determinants of health that impede their access to and benefit from the proposed treatment. This means working collaboratively with the patient and relevant community resources to mitigate barriers such as transportation, housing instability, or lack of social support. This approach is ethically and regulatorily sound because it aligns with the principles of patient-centered care and health equity, which are fundamental in healthcare economics and policy. It recognizes that health outcomes are not solely determined by clinical interventions, but are heavily influenced by social and economic factors. By addressing these underlying issues, healthcare providers can ensure that the proposed treatment has a genuine opportunity to be effective, and that resources are not expended on interventions that are unlikely to yield positive results due to unaddressed social barriers. This proactive and holistic approach promotes better long-term health outcomes and more efficient use of healthcare resources by tackling root causes. An incorrect approach would be to deny the proposed treatment solely based on the patient's current social circumstances, without exploring mitigation strategies. This fails to acknowledge the impact of social determinants of health and could lead to inequitable care. Ethically, it violates the principle of justice by potentially disadvantaging a patient due to factors beyond their control. Regulatorily, it may contravene guidelines that promote access to care and address health disparities. Another incorrect approach would be to proceed with the treatment without any consideration for the patient's social barriers, assuming the patient will somehow overcome them independently. This is ethically problematic as it places an undue burden on the patient and is unlikely to lead to successful outcomes, thus representing a poor use of healthcare resources. It also fails to uphold the professional responsibility to ensure a patient can benefit from the care provided. A third incorrect approach would be to dismiss the patient's social circumstances as irrelevant to the clinical decision, focusing only on the medical necessity of the treatment. This demonstrates a lack of understanding of the interconnectedness of social factors and health outcomes, a core concept in healthcare economics and policy. It ignores the evidence that social determinants significantly influence treatment adherence and efficacy, leading to potentially wasted resources and poorer patient outcomes. The professional decision-making process for similar situations should involve a thorough assessment of the patient's social determinants of health alongside their clinical needs. This requires interdisciplinary collaboration, including social workers and community health navigators, to develop a comprehensive care plan that addresses both medical and social barriers. Professionals should advocate for resources and policies that support equitable access to care and promote health equity, recognizing that effective healthcare delivery extends beyond the clinical encounter. Question 2. The investigation demonstrates that a hospital is experiencing a significant shortage of a life-saving medication due to supply chain disruptions. Several patients require this medication urgently, but there is only enough for a fraction of them. The attending physician must decide how to allocate the limited supply, considering both the patient's immediate medical needs and the hospital's financial constraints. Which of the following represents the most ethically and economically sound approach to allocating the scarce medication? Option A. Make the decision based on which patient the physician has the closest personal relationship with, as this would ensure the medication goes to someone the physician feels most comfortable advocating for. Option B. Prioritize patients based on a predefined clinical triage protocol that objectively assesses the severity of their condition, likelihood of benefit from the medication, and potential for survival, while also considering the hospital's long-term financial sustainability in its resource allocation decisions. Option C. Allocate the medication to the patients who have the best health insurance coverage, as this would ensure the hospital can recoup its costs and continue to provide services to other patients. Option D. Distribute the medication equally among all patients who require it, even if this means each patient receives a subtherapeutic dose, to ensure no patient is denied access. Correct answer is B. Prioritize patients based on a predefined clinical triage protocol that objectively assesses the severity of their condition, likelihood of benefit from the medication, and potential for survival, while also considering the hospital's long-term financial sustainability in its resource allocation decisions. Explanation. The investigation demonstrates a scenario where a healthcare provider faces an ethical dilemma concerning resource allocation, a core issue in healthcare economics. This situation is professionally challenging because it requires balancing the immediate needs of individual patients with the broader economic realities and ethical obligations of the healthcare system. The provider must make a decision that has significant implications for patient well-being, financial sustainability, and adherence to professional standards, all within the context of limited resources. Careful judgment is required to navigate these competing demands ethically and effectively. The correct approach involves a systematic and transparent process for resource allocation that prioritizes based on established clinical criteria and ethical principles, such as fairness, equity, and maximizing benefit. This approach acknowledges that not all demands can be met simultaneously and seeks to ensure that decisions are made impartially and with the greatest good for the greatest number, while respecting individual patient dignity. This aligns with the principles of distributive justice in healthcare economics, which guides the fair allocation of scarce resources. Regulatory frameworks and ethical guidelines for healthcare professionals emphasize the importance of evidence-based decision-making and equitable access to care, even when resources are constrained. An incorrect approach would be to allocate resources based on personal bias or favoritism. This fails to uphold the principle of fairness and equity, potentially leading to discrimination and violating professional ethical codes that mandate impartial treatment of all patients. Such an approach could also expose the provider and the institution to legal challenges and reputational damage. Another incorrect approach would be to prioritize patients who can pay more, regardless of their clinical need. This directly contravenes ethical principles of justice and equity in healthcare, and is likely to be in violation of regulations designed to ensure access to care based on medical necessity rather than financial capacity. This approach exacerbates health disparities and undermines the fundamental purpose of healthcare. A third incorrect approach would be to ignore the resource constraints and attempt to provide every requested service, regardless of cost or availability. While seemingly compassionate, this approach is unsustainable and can lead to the depletion of resources, ultimately harming a larger number of patients in the long run. It also fails to acknowledge the economic realities that necessitate careful resource management within the healthcare system. The professional decision-making process for similar situations should involve consulting established institutional policies on resource allocation, seeking guidance from ethics committees or senior colleagues, and applying objective clinical criteria. Professionals should be trained in ethical decision-making frameworks that help them analyze dilemmas, identify relevant principles, and arrive at justifiable conclusions. Transparency in the decision-making process, where appropriate, can also foster trust and understanding among patients and stakeholders. Question 3. During the evaluation of a proposed new hospital wing for specialized cardiac care, what approach best reflects the consideration of opportunity cost within the U.S. healthcare regulatory framework? Option A. Analyzing the projected revenue increase from the new wing and comparing it to its construction and operational costs. Option B. Prioritizing the new wing based on the lobbying efforts of cardiac specialists and patient advocacy groups. Option C. Focusing solely on the technological advancements and specialized equipment that the new wing will house and their direct impact on cardiac treatment. Option D. Assessing the potential improvement in cardiac patient outcomes and the reduction in wait times for cardiac procedures, while also considering the alternative uses of the capital and operational funds, such as expanding primary care services or investing in preventative health programs. The correct answer is A. Analyzing the projected revenue increase from the new wing and comparing it to its construction and operational costs. Explanation. This scenario is professionally challenging because healthcare resource allocation inherently involves trade-offs, and understanding opportunity cost is crucial for making ethically sound and economically efficient decisions. The CEBS exam emphasizes the application of economic principles within the healthcare context. An opportunity cost is a fundamental concept. Professionals must balance competing demands for limited resources, such as funding for new treatments versus preventative care programs, or investing in advanced technology versus staffing. The challenge lies in quantifying these trade-offs and making decisions that maximize overall societal benefit, adhering to both economic efficiency and ethical considerations. The correct approach involves a comprehensive evaluation that explicitly considers the value of the foregone alternative when making a healthcare decision. This means acknowledging that choosing one intervention or program means foregoing the benefits that could have been derived from another. For example, if a hospital decides to invest in a new MRI machine, the opportunity cost is the potential improvement in patient outcomes or the expansion of other essential services that could have been funded with that same capital. This approach aligns with the principles of economic efficiency, aiming to achieve the greatest good with the available resources. It also reflects ethical obligations to use resources responsibly and to consider the broader impact on patient populations and the healthcare system. Regulatory frameworks, while not always explicitly dictating opportunity cost calculations, implicitly support this by requiring prudent financial management and the pursuit of value in healthcare. An incorrect approach would be to focus solely on the direct costs and benefits of a single intervention without considering what else could have been achieved with those resources. For instance, approving funding for a new, expensive drug based only on its projected efficacy, without considering the impact on funding for essential public health initiatives or primary care services, represents a failure to account for opportunity cost. This can lead to misallocation of resources, where less effective or less impactful programs are underfunded, ultimately harming overall population health. Ethically, this approach fails to uphold the principle of distributive justice, which requires fair allocation of scarce resources. Another incorrect approach is to ignore the economic implications entirely and make decisions based purely on anecdotal evidence or political pressure, without a systematic evaluation of alternatives. This can lead to inefficient spending and a failure to achieve optimal health outcomes for the population. The professional decision-making process for similar situations should involve a structured framework that includes identifying all relevant alternatives, estimating the costs and benefits, both direct and indirect, of each alternative, explicitly considering the opportunity cost of the chosen option, and evaluating the decision against established ethical principles and regulatory requirements. This systematic approach ensures that decisions are not only economically rational, but also ethically defensible and aligned with the overarching goals of the healthcare system. Question 4. Compliance review shows that a large integrated health system is struggling with rising costs associated with managing chronic conditions. The system is considering several strategies to address this financial pressure. Which of the following approaches best balances economic sustainability with the ethical and regulatory imperative to provide quality care to all patients within the U.S. healthcare framework? Option A. Implementing a tiered formulary that significantly limits access to newer, more expensive medications for chronic diseases, even when clinically indicated, to reduce pharmaceutical spending. Option B. Increasing patient co-payments and deductibles across all health plans offered by the system, regardless of the patient's ability to pay or the necessity of the services received. Option C. Developing and implementing care coordination programs that utilize telehealth, remote patient monitoring, and patient education to manage chronic conditions proactively, alongside exploring value-based purchasing agreements with providers. Option D. Reducing the number of available specialist appointments for patients with chronic conditions to encourage self-management and reduce the utilization of specialized services. The correct answer is A. Implementing a tiered formulary that significantly limits access to newer, more expensive medications for chronic diseases, even when clinically indicated, to reduce pharmaceutical spending. Explanation: this scenario presents a professional challenge because it requires balancing the economic realities of healthcare provision with the ethical and regulatory obligations to ensure patient access to necessary care. The CEBS exam focuses on understanding these complex interactions within the U.S. healthcare system. The core difficulty lies in implementing cost containment strategies without compromising the quality of care or violating patient rights and regulatory mandates. Careful judgment is required to navigate the tension between financial sustainability and the principle of equitable access to healthcare services. The correct approach involves a multifaceted strategy that prioritizes patient well-being and regulatory compliance while seeking efficiencies. This includes exploring alternative care pathways, leveraging technology for remote monitoring, and engaging in proactive patient education to prevent exacerbations. These methods are aligned with the principles of value-based care, which emphasize outcomes and efficiency. Regulatory justification stems from the need to adhere to laws like the Affordable Care Act, ACA, which promotes access and quality, and ethical considerations that mandate acting in the patient's best interest. An incorrect approach would be to unilaterally restrict access to certain high-cost treatments without a thorough review of their necessity or exploring less expensive alternatives. This could lead to regulatory violations, such as discrimination against patients with specific conditions, and ethical breaches by prioritizing cost over patient health. Another incorrect approach is to implement blanket cost-sharing increases without considering the impact on vulnerable populations, potentially violating affordability provisions and exacerbating health disparities. Failing to engage patients in shared decision-making regarding treatment options also represents a failure to uphold patient autonomy and can lead to dissatisfaction and non-adherence, ultimately increasing costs. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's clinical needs and the available treatment options. This should be followed by an assessment of the economic implications and potential cost-saving measures, always within the bounds of regulatory compliance and ethical principles. Engaging all stakeholders, including patients, providers, and payers, in a transparent dialogue is crucial for developing sustainable and equitable healthcare solutions. Question 5. Strategic planning requires health plan administrators to identify opportunities for reducing administrative costs, considering the regulatory environment and the need to maintain member satisfaction and access to care. Which of the following strategies would be the most prudent and compliant approach to achieving administrative cost savings? Option A. Eliminating or drastically curtailing the prior authorization process for a broad range of medical services to reduce processing overhead. Option B. Implementing a comprehensive review of operational workflows and vendor contracts to identify efficiencies and renegotiate terms, while ensuring no degradation in member service levels or compliance with regulatory mandates. Option C. Outsourcing all claims processing functions to a new vendor without a thorough evaluation of their compliance track record or service level agreements. Option D. Significantly reducing the number of staff in member support departments to meet a specific cost reduction target, regardless of potential impacts on response times and member access to assistance. The correct answer is B. Implementing a comprehensive review of operational workflows and vendor contracts to identify efficiencies and renegotiate terms, while ensuring no degradation in member service levels or compliance with regulatory mandates. Explanation: this scenario is professionally challenging because it requires a health plan administrator to balance the imperative to control administrative costs with the ethical and regulatory obligations to ensure member access to care and the overall financial solvency of the plan. The CEBS exam emphasizes understanding the economic and ethical underpinnings of health plan management within the U.S. regulatory framework. A key challenge is that reducing administrative costs too aggressively can inadvertently harm member experience, increase downstream medical costs due to delayed or denied care, and violate regulatory requirements designed to protect beneficiaries. Careful judgment is required to identify cost-saving measures that are sustainable, compliant, and do not compromise the quality of service or the plan's ability to fulfill its obligations. The correct approach involves a comprehensive review of operational efficiencies and vendor contracts to identify areas where administrative overhead can be reduced without negatively impacting member services or compliance. This might include leveraging technology for claims processing, streamlining member onboarding, or renegotiating service-level agreements with third-party administrators. This approach is correct because it aligns with the regulatory expectation that health plans operate efficiently while prioritizing member well-being and adherence to laws such as the Affordable Care Act, ACA, which mandates certain levels of medical loss ratios, MLR, and consumer protections. It also reflects a commitment to fiduciary responsibility, ensuring the plan's resources are used effectively to provide benefits. An incorrect approach would be to implement across-the-board staff reductions in member services departments solely to meet a predetermined cost-saving target. This is ethically problematic as it can lead to longer wait times, reduced access to support, and increased member frustration, potentially impacting their ability to navigate their benefits and access necessary care. From a regulatory standpoint, such actions could indirectly lead to non-compliance with service standards or consumer protection provisions if member access to information and support is significantly degraded. Another incorrect approach would be to unilaterally terminate or significantly reduce essential administrative functions, such as claims review or prior authorization processes, without a robust plan for their replacement or redesign. This poses a significant regulatory risk, as these processes are critical for ensuring appropriate utilization of services and preventing fraud, waste, and abuse, all of which are subject to oversight. Failure to maintain these functions could lead to improper payments, increased medical costs, and potential penalties for non-compliance with federal and state regulations governing health insurance operations. Finally, an incorrect approach would be to outsource administrative functions to vendors without adequate due diligence regarding their compliance capabilities and service quality. This can lead to hidden costs, service failures, and regulatory breaches if the vendor does not meet required standards. The health plan remains ultimately responsible for the actions of its vendors, and a failure to oversee them properly can result in significant legal and financial repercussions. The professional decision-making process for similar situations should involve a multifaceted analysis that considers the impact on all stakeholders: members, providers, employees, and the plan itself. It requires a thorough understanding of the current operational landscape, identification of potential risks and benefits associated with any proposed change, and a clear assessment of regulatory compliance. Professionals should prioritize data-driven decisions, engage relevant internal and external experts, and ensure that any cost-saving initiatives are implemented in a phased and monitored manner to mitigate unintended consequences and maintain a high standard of service and compliance. Question 6. Comparative studies suggest that in healthcare markets, the interplay of supply and demand can lead to significant access and affordability challenges. A health insurance plan observes a growing shortage of in-network mental health providers in a particular geographic region, leading to increased wait times and out-of-pocket costs for its members. Which of the following approaches best reflects a professional and regulatory compliant response to this situation? Option A. Actively recruit and contract with additional mental health providers in the affected region, potentially offering enhanced reimbursement rates or support services to incentivize participation, while ensuring compliance with network adequacy regulations. Option B. Advise members to seek care outside the network and seek reimbursement, assuming that market forces will eventually correct the supply shortage. Option C. Reduce the number of covered mental health services to manage costs, arguing that the high demand and limited supply justify a more restrictive benefit design. Option D. Lobby for the elimination of regulations that mandate network adequacy standards, believing that deregulation will ultimately increase provider supply. The correct answer is A. Actively recruit and contract with additional mental health providers in the affected region, potentially offering enhanced reimbursement rates support services to incentivize participation, while ensuring compliance with network adequacy regulations. Explanation: this scenario is professionally challenging because it requires balancing the economic principles of supply and demand with the ethical imperative to ensure access to essential health services. Professionals must navigate situations where market forces might lead to suboptimal outcomes for patient care, particularly for vulnerable populations. Careful judgment is required to identify and apply appropriate regulatory and ethical frameworks to guide decision-making. The correct approach involves recognizing that while supply and demand dynamics are fundamental to healthcare markets, they are also subject to significant regulatory oversight and ethical considerations. This approach prioritizes understanding how specific regulations, such as those governing provider networks, reimbursement rates, and patient access to care, interact with market forces. It also involves considering the ethical implications of market outcomes on patient well-being and equity. For example, understanding how regulations might influence the supply of physicians in underserved areas, or how demand for specific treatments is affected by insurance coverage limitations, is crucial. This aligns with the CEBS exam's focus on the economic and ethical dimensions of healthcare, emphasizing that market efficiency must be tempered by regulatory compliance and a commitment to patient welfare. An incorrect approach would be to solely focus on maximizing provider revenue by limiting supply in areas with high demand, without considering the regulatory implications of such actions or the ethical duty to serve patients. This could lead to violations of network adequacy rules or anti-competitive practices, depending on the specific jurisdiction's laws. Another incorrect approach would be to ignore the economic realities of supply and demand and advocate for unlimited access to all services regardless of cost or resource availability, which would be unsustainable and likely violate fiscal responsibility principles and potentially regulations related to resource allocation. A third incorrect approach would be to assume that market forces alone will naturally lead to equitable access, disregarding the documented market failures in healthcare, such as information asymmetry and externalities, which often necessitate regulatory intervention. Professionals should employ a decision-making framework that begins with identifying the core economic issue, e.g., a supply-demand imbalance. This should be followed by a thorough review of relevant regulations governing the specific healthcare market segment. Simultaneously, ethical principles related to patient access, equity, and quality of care must be considered. The decision-making process should then involve evaluating potential solutions through the lens of both economic feasibility and regulatory compliance, always prioritizing patient well-being and adherence to ethical standards. Question 7. Cost-benefit analysis shows that reducing the number of in-network specialists by terminating contracts with those who have higher reimbursement rates could significantly lower the MCO's operating expenses. However, this action might disrupt care for a substantial number of patients currently undergoing treatment with these specialists and could lead to a shortage of certain specialties in specific geographic areas. Which of the following approaches best aligns with regulatory compliance and ethical considerations for the managed care organization? Option A. Inform affected specialists of their contract termination with minimal notice to prevent them from making alternative arrangements, thereby ensuring the MCO's cost savings are maximized. Option B. Proceed with terminating contracts with higher reimbursed specialists immediately to realize cost savings and address patient disruption on a case-by-case basis as it arises. Option C. Conduct a thorough review of all provider contracts, assess the impact on network adequacy and continuity of care for affected enrollees, and develop a phased transition plan that includes robust communication with both providers and patients, while exploring alternative cost containment strategies. Option D. Focus solely on the financial benefits of the proposed terminations, assuming that patients will naturally find alternative providers without significant MCO intervention. The correct answer is B. Proceed with terminating contracts with higher reimbursed specialists immediately to realize cost savings and address patient disruption on a case-by-case basis as it arises. Explanation: this scenario presents a professional challenge because a managed care organization, MCO, is considering a change in its provider network that could significantly impact patient access to care and the financial viability of certain providers, while also aiming to control costs. The MCO must balance its fiduciary duty to its members and shareholders with its contractual obligations to providers and the regulatory requirements governing its operations. Careful judgment is required to ensure that any network changes are implemented in a manner that is compliant with all applicable laws and ethical standards, particularly those related to patient care continuity and fair provider compensation. The correct approach involves a thorough review of the MCO's contractual agreements with its providers, the terms of its benefit plans offered to enrollees, and all relevant state and federal regulations governing managed care. This includes understanding requirements related to network adequacy, continuity of care for patients undergoing treatment, and the process for notifying providers and enrollees of network changes. The MCO must also consider the economic impact on providers and ensure that any proposed changes do not lead to discriminatory practices or violate antitrust laws. Adherence to these regulatory and contractual frameworks is paramount to ensuring the MCO operates ethically and legally, safeguarding patient well-being, and maintaining a stable provider network. An incorrect approach would be to prioritize cost savings above all else, without adequately assessing the impact on patient access and continuity of care. This could lead to violations of network adequacy standards, which mandate that MCOs provide sufficient access to providers for their enrollees. Failing to provide adequate notice to providers and enrollees about network changes would also be a regulatory failure, as many laws require specific notification periods and methods. Another incorrect approach would be to unilaterally alter reimbursement rates, contract terms without following the established contractual procedures or engaging in good faith negotiations, which could lead to breach of contract claims and regulatory penalties. Furthermore, making decisions based on incomplete or biased cost-benefit analyses that do not fully account for the long-term consequences on patient health outcomes or provider relationships would be professionally unsound and potentially violate ethical obligations to serve the best interests of the enrollees. Professionals should approach such situations by first identifying all applicable regulatory frameworks and contractual obligations. They should then conduct a comprehensive assessment of the proposed changes, considering all stakeholder impacts: patients, providers, and the MCO itself. This assessment should be informed by legal counsel and subject matter experts. A structured decision-making process would involve 1. Identifying the core objective, e.g., cost reduction. 2. Evaluating potential strategies against regulatory and contractual requirements. 3. Assessing the risks and benefits of each strategy for all stakeholders. 4. Selecting the strategy that best balances objectives with compliance and ethical considerations. And 5. Developing a clear implementation plan that includes robust communication and grievance procedures. Question 8. Investigation of a proposed government policy to implement price controls on a newly approved, life-saving cancer medication reveals that, while the proposed price reduction would significantly lower healthcare system expenditures, it could also reduce the manufacturer's profit margins to a level that might deter future investment in research and development for similar complex treatments. What is the most ethically and professionally sound approach for a healthcare economics consultant to recommend? Option A. Recommend a phased price reduction tied to demonstrated improvements in patient survival rates and quality of life, coupled with incentives for continued research and development. Option B. Recommend immediate implementation of the proposed price reduction to maximize short-term cost savings for the healthcare system. Option C. Recommend opposing all price controls on this medication to ensure continued innovation and market availability. Option D. Recommend a price control that significantly lowers the cost, but does not consider the impact on future research and development. The correct answer is A. Recommend a phased price reduction tied to demonstrated improvements in patient survival rates and quality of life, coupled with incentives for continued research and development. Explanation: this scenario presents a professional challenge because it forces a decision-maker to balance the economic imperative of controlling healthcare costs with the ethical obligation to ensure access to necessary medical treatments. The core tension lies in the potential for price controls to limit the availability or innovation of life-saving drugs, thereby impacting patient well-being, while simultaneously addressing the societal burden of escalating healthcare expenditures. Careful judgment is required to navigate these competing interests without compromising either economic sustainability or ethical patient care. The correct approach involves advocating for a price control mechanism that incorporates a robust assessment of clinical value and patient outcomes. This approach prioritizes ensuring that any price limitations do not disproportionately hinder access to treatments that offer significant therapeutic benefit. It aligns with ethical principles of beneficence and justice by seeking to make essential medicines affordable while safeguarding the quality and availability of care. Regulatory frameworks often encourage or mandate such value-based assessments to ensure that price controls are not arbitrary, but are tied to demonstrable improvements in health. An incorrect approach would be to advocate for across-the-board price reductions without considering the specific therapeutic value or market dynamics of different drugs. This could lead to unintended consequences, such as discouraging research and development for rare diseases or drugs with high manufacturing costs, ultimately limiting future treatment options. Ethically, this approach fails to uphold the principle of justice by potentially creating disparities in access based on economic feasibility rather than medical need. Another incorrect approach would be to resist all forms of price control, arguing solely for market-driven pricing. While this might incentivize innovation, it ignores the ethical and economic realities of unsustainable healthcare costs, potentially leading to a system where essential treatments are inaccessible to a significant portion of the population due to prohibitive prices. This fails to address the societal obligation to ensure equitable access to healthcare. A further incorrect approach would be to implement price controls that are so stringent they lead to drug shortages or withdrawal from the market. This directly contradicts the ethical duty to provide care and would have severe negative consequences for patient health, regardless of the cost savings achieved. Professional decision-making process for similar situations should involve a thorough understanding of the specific drug or treatment in question, its clinical efficacy, patient populations affected, and the economic impact of various pricing scenarios. It requires consulting relevant regulatory guidelines, engaging with stakeholders, including patient advocacy groups and healthcare providers, and considering the long-term implications for both innovation and access. A balanced approach that prioritizes patient well-being within a sustainable economic framework is paramount. Question 9. The control framework reveals an opportunity to significantly reduce administrative overhead within a health insurance provider's claims processing department through the implementation of advanced artificial intelligence for automated adjudication. However, this initiative must be carefully managed to ensure it aligns with all U.S. federal and state healthcare regulations. Which of the following approaches best balances process optimization with regulatory compliance and patient welfare? Option A. Conduct a thorough regulatory impact assessment of the AI system's proposed functionalities, ensuring it meets all requirements for claims adjudication, patient notification, and appeal processes before a phased rollout. Option B. Deploy the AI system for a limited set of simple claims, while continuing manual processing for complex cases, without a formal regulatory review of the AI's decision-making logic. Option C. Implement the AI system immediately to process all claims, with a post-implementation review to identify any regulatory discrepancies. Option D. Focus solely on the AI's ability to reduce processing time and cost, assuming that regulatory compliance will be addressed through general staff training on existing policies. The correct answer is C. Implement the AI system immediately to process all claims, with a post-implementation review to identify any regulatory discrepancies. Explanation. This scenario presents a professional challenge because it requires balancing the imperative of improving healthcare delivery system efficiency with the absolute priority of adhering to the regulatory framework governing health insurance and healthcare provision within the United States, as mandated by the CEBS exams jurisdiction. The core tension lies in implementing process optimization without inadvertently creating barriers to access, compromising patient care quality, or violating specific regulations related to provider networks, reimbursement, or patient rights. Careful judgment is required to ensure that efficiency gains do not come at the expense of regulatory compliance and ethical patient-centered care. The correct approach involves a comprehensive review of existing workflows and patient pathways, identifying bottlenecks and areas for improvement, and then proposing and implementing changes that are demonstrably aligned with all applicable U.S. healthcare regulations. This includes ensuring that any optimization does not lead to discriminatory practices, reduced access to necessary care for specific patient populations, or noncompliance with reporting requirements. The justification for this approach is rooted in the fundamental principles of healthcare regulation in the U.S., which prioritize patient well-being, equitable access, and provider accountability. Specifically, it aligns with the spirit and letter of laws like the Affordable Care Act, ACA, which emphasizes access to care and consumer protections, and HIPAA, which mandates patient privacy. Ethical considerations also demand that efficiency improvements serve to enhance, not detract from, the patient experience and health outcomes. An incorrect approach would be to prioritize cost reduction or speed of service above all else, without a thorough regulatory impact assessment. For instance, streamlining provider networks to reduce administrative overhead, without ensuring adequate geographic or specialty coverage for the insured population, would violate regulations requiring reasonable access to care. Similarly, implementing automated denial processes for certain claims without robust human oversight and appeal mechanisms could contravene patient rights and due process protections. Another failure would be to adopt new technologies or data management systems without ensuring full compliance with HIPAA stringent privacy and security rules, leading to potential breaches and significant legal repercussions. Professionals should employ a decision-making framework that begins with a clear understanding of the regulatory landscape. Before proposing any optimization, they must identify all relevant federal and state laws, as well as any specific guidelines from regulatory bodies like CMS. The process should involve cross-functional teams, including legal and compliance experts, to assess the potential impact of proposed changes. Pilot testing and phased implementation with continuous monitoring for regulatory adherence and patient impact are crucial. Any proposed optimization must be evaluated against a dual criterion: demonstrable efficiency gains and unwavering regulatory compliance and ethical patient care. Question 10. Governance review demonstrates that a healthcare organization is considering the adoption of a novel AI-powered diagnostic tool to enhance early detection of a specific disease. While the technology promises significant improvements in accuracy and speed, concerns have been raised regarding its integration into existing clinical workflows, the security of patient data processed by the AI, and the potential for algorithmic bias impacting certain patient demographics. Which of the following approaches best addresses these implementation challenges within the U.S. regulatory framework? Option A. Immediately deploy the AI tool across all relevant departments to capitalize on its perceived efficiency gains, assuming that standard IT security measures are sufficient. Option B. Conduct a comprehensive pilot program in a controlled environment, involving rigorous testing of the AI's accuracy, security protocols, and potential biases, with ongoing data privacy impact assessments and clinician training before a phased rollout. Option C. Rely solely on the vendor's assurances regarding the AI's performance and compliance, and proceed with a full-scale implementation to realize cost savings. Option D. Implement the AI tool with minimal disruption, focusing primarily on the technical aspects of integration and deferring detailed patient data privacy and bias assessments to a later stage. The correct answer is B. Conduct a comprehensive pilot program in a controlled environment, involving rigorous testing of the AI's accuracy, security protocols, and potential biases, with ongoing data privacy impact assessments and clinician training before a phased rollout. Explanation: this scenario presents a professional challenge because it requires balancing the potential benefits of a new technological advancement in healthcare delivery with the inherent risks and regulatory obligations. The challenge lies in ensuring that the implementation of such technology aligns with the principles of patient safety, data privacy, and equitable access, all within the specific regulatory framework governing healthcare in the United States. Careful judgment is required to navigate the complexities of technological adoption while upholding ethical standards and legal mandates. The correct approach involves a comprehensive risk assessment and a phased implementation strategy. This approach is right because it prioritizes patient well-being and regulatory compliance. A thorough risk assessment, conducted in accordance with HIPAA and other relevant U.S. healthcare regulations, identifies potential vulnerabilities related to data security, patient privacy, and clinical efficacy. A phased implementation allows for controlled testing, validation, and adaptation, minimizing disruption and ensuring that the technology is integrated safely and effectively. This aligns with the ethical imperative to do no harm and the regulatory requirement to implement technologies in a manner that protects patient information and ensures quality of care. An incorrect approach would be to proceed with immediate and widespread adoption without adequate testing or risk mitigation. This fails to meet the regulatory requirement for due diligence in adopting new technologies that impact patient care and data. It also violates ethical principles by potentially exposing patients to unvetted risks. Another incorrect approach is to prioritize cost savings or perceived efficiency over a robust evaluation of the technology's impact on patient outcomes and data security. This demonstrates a failure to adhere to the fiduciary duty owed to patients and the regulatory emphasis on patient safety and privacy as paramount. A further incorrect approach is to delegate the entire decision-making process to the IT department without involving clinical staff and legal/compliance officers. This bypasses essential expertise in clinical workflow, patient care, and regulatory interpretation, leading to potential noncompliance and suboptimal implementation. Professionals should employ a structured decision-making framework that begins with identifying the need or opportunity presented by the technological advancement. This should be followed by a thorough investigation of the technology's capabilities, limitations, and potential impacts, including a comprehensive risk assessment that considers clinical, operational, financial, and regulatory factors. Engaging all relevant stakeholders, including clinicians, IT professionals, legal counsel, and compliance officers, is crucial for a holistic evaluation. The decision-making process should then involve developing and evaluating different implementation strategies, prioritizing those that demonstrate the highest likelihood of achieving desired outcomes, while minimizing risks and ensuring compliance with all applicable U.S. healthcare laws and regulations. Finally, a plan for ongoing monitoring and evaluation of the technology's performance and impact should be established. Question 11. The review process indicates that a health technology assessment for a new preventative therapy is considering the economic implications of its long-term benefits. The evaluation team is debating how to account for the health improvements that will accrue to patients many years into the future. Which of the following approaches best aligns with established principles for discounting future health benefits in economic evaluations for healthcare resource allocation? Option A. Utilize a private discount rate, reflecting individual preferences for immediate gratification, to value future health gains. Option B. Apply a social discount rate to future health benefits to reflect the time value of money and societal opportunity costs. Option C. Do not discount future health benefits, as all health outcomes are equally valuable regardless of when they occur. Option D. Apply an arbitrarily high discount rate to future health benefits to ensure that current resource allocation is prioritized. The correct answer is B. Apply a social discount rate to future health benefits to reflect the time value of money and societal opportunity costs. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a nuanced understanding of how to value future health benefits in the context of economic evaluations, which are crucial for resource allocation decisions in healthcare. The core difficulty lies in the inherent uncertainty of future outcomes and the need to account for the time value of money, a concept central to health economics. Professionals must balance the desire to capture the full potential benefit of an intervention with the practical necessity of making current decisions based on present values. This requires careful consideration of established methodologies and regulatory guidance to ensure fairness, efficiency, and ethical resource distribution. Correct approach analysis. The correct approach involves applying a social discount rate to future health benefits. This method acknowledges that individuals and society generally prefer benefits received sooner rather than later. Applying a discount rate reflects this time preference and also accounts for opportunity costs, the benefits that could be gained by investing resources elsewhere in the present. Regulatory frameworks, such as those guiding health technology assessments in many jurisdictions, typically mandate the use of a social discount rate to ensure consistency and comparability across different evaluations. This approach aligns with economic principles and promotes efficient allocation of scarce healthcare resources by ensuring that future benefits are appropriately weighed against present costs and benefits. Incorrect approach is analysis. Ignoring the time value of money by not discounting future health benefits is an incorrect approach. This fails to acknowledge that a health benefit received in the future is generally less valuable to individuals and society than the same benefit received today. This can lead to overestimation of the value of interventions with long-term benefits and potentially misallocation of resources. Using a private discount rate instead of a social discount rate is also incorrect. Private discount rates reflect individual preferences for immediate gratification and are typically higher than social discount rates. While relevant for individual financial decisions, they do not accurately represent societal preferences for health outcomes or the opportunity cost of public healthcare spending. Employing a private rate would distort the economic evaluation and lead to suboptimal resource allocation from a societal perspective. Applying an arbitrarily high discount rate without justification is another incorrect approach. While discounting is necessary, an excessively high rate would unduly devalue future health benefits, potentially leading to the rejection of interventions that offer significant long-term value but have delayed benefits. This would be inconsistent with the principles of fairness and equity in healthcare, as it would disproportionately disadvantage interventions that benefit future generations or address chronic conditions with long recovery periods. Professional reasoning. Professionals should approach this by first identifying the relevant regulatory framework for health economic evaluations within their specific jurisdiction. This framework will dictate the acceptable methodologies for discounting. The decision-making process should involve understanding the theoretical underpinnings of discounting, recognizing the distinction between social and private rates, and adhering to any prescribed discount rates or ranges provided by regulatory bodies. When faced with uncertainty or the need for sensitivity analysis, professionals should explore the impact of different discount rates within acceptable bounds, clearly documenting their assumptions and justifications. The ultimate goal is to produce evaluations that are transparent, methodologically sound, and ethically defensible, leading to informed and efficient healthcare resource allocation. Question 12. Process analysis reveals that a health insurance company operating under U.S. federal regulations is considering significant changes to its plan offerings to improve profitability. These changes include introducing new plans with narrower provider networks and higher deductibles, as well as exploring options to limit coverage for certain preventive services that are currently mandated under the Patient Protection and Affordable Care Act. From a stakeholder perspective, which of the following approaches best aligns with the regulatory framework governing health insurance in the United States? Option A. Focus on designing plans that offer the lowest possible premiums by excluding coverage for a broad range of preventive services and limiting provider networks to only the most cost-effective options, regardless of regulatory mandates. Option B. Implement a strategy that prioritizes maximizing shareholder returns by introducing plans with significantly higher cost-sharing for consumers and fewer covered benefits, with the expectation that regulatory enforcement will be lenient. Option C. Prioritize the development of plans that strictly adhere to all mandated essential health benefits and coverage requirements, while exploring cost containment strategies within the existing regulatory framework that do not compromise consumer access or affordability. Option D. Advocate for the repeal of key provisions of the Patient Protection and Affordable Care Act, arguing that deregulation will foster greater market competition and lead to lower premiums for all consumers. The correct answer is C. Prioritize the development of plans that strictly adhere to all mandated essential health benefits and coverage requirements, while exploring cost containment strategies within the existing regulatory framework that do not compromise consumer access or affordability. Explanation. This scenario is professionally challenging because it requires navigating the complex interplay between government regulation, the economic realities of health insurance markets, and the diverse interests of stakeholders. Professionals must balance the goals of ensuring access to affordable coverage with the financial sustainability of insurance plans and the economic impact on employers and individuals. Careful judgment is required to interpret and apply specific regulatory frameworks without overstepping their mandates or creating unintended negative consequences. The correct approach involves a thorough understanding of the specific regulatory framework governing health insurance in the United States, as mandated by the CEBS exam's jurisdiction. This includes a deep dive into the Patient Protection and Affordable Care Act, ACA, and its implementing regulations, such as those from the Department of Health and Human Services, HHS, and the Department of Labor, DOL. Professionals must analyze how these regulations, such as essential health benefits, guaranteed issue, and premium subsidies, aim to achieve public policy objectives. The correct approach would focus on how these regulations impact market dynamics, provider networks, and cost-sharing mechanisms, and how insurers must adapt their business models to comply while remaining economically viable. This involves understanding the economic rationale behind the regulations and their intended effects on consumer behavior and market competition. An incorrect approach would be to focus solely on the financial profitability of the insurance company without adequately considering the regulatory requirements for consumer protection and market stability. This might lead to strategies that, while potentially increasing profits, violate mandates regarding coverage limitations, denial of pre-existing conditions, or excessive premium increases, thereby failing to meet the spirit and letter of the law. Another incorrect approach would be to advocate for significant deregulation without a comprehensive analysis of the potential negative impacts on consumer access and affordability, ignoring the established public policy goals embedded in current U.S. health insurance laws. This could lead to a return to market conditions, where individuals with pre-existing conditions face prohibitive costs or are denied coverage altogether, undermining the foundational principles of the ACA. A third incorrect approach would be to prioritize the interests of a single stakeholder group, such as employers, without considering the broader implications for individuals, providers, and the overall health insurance market, potentially leading to solutions that are not equitable or sustainable. Professionals should employ a decision-making framework that begins with a clear identification of the specific regulatory requirements applicable to the situation. This should be followed by an analysis of the economic implications of these regulations on all relevant stakeholders. The next step involves evaluating potential strategies or policy recommendations against these regulatory mandates and economic realities, ensuring that proposed actions are compliant, economically sound, and aligned with the overarching public policy goals of the U.S. health insurance system. This iterative process of regulatory review, economic analysis, and stakeholder consideration is crucial for making sound professional judgments. Question 13. Assessment of a new pharmaceutical intervention for a chronic disease requires a cost-effectiveness analysis. The intervention has demonstrated significant clinical benefits in improving patient quality of life and reducing symptom severity. However, its acquisition cost is considerably higher than existing treatments. The evaluation team is considering different approaches to present the value proposition of this new drug. Which approach best aligns with the principles of cost-effectiveness analysis within a regulated healthcare system focused on maximizing population health outcomes within resource constraints? Option A, focusing on the innovative nature of the drug and its potential to disrupt the current treatment paradigm, citing expert opinions on its future impact. Option B, providing a cost comparison with existing treatments, focusing solely on the acquisition cost of the drug, and ignoring the potential differences in long-term resource utilization or health outcomes. Option C, presenting a detailed cost-effectiveness ratio, e.g., cost per quality-adjusted life year gained, derived from a robust model that incorporates clinical trial data, real-world evidence on resource utilization, and appropriate discounting for future costs and benefits. Option D, highlighting the significant improvements in patient-reported outcomes and the reduction in symptom severity, emphasizing the qualitative benefits without a formal cost-effectiveness calculation. The correct answer is C, presenting a detailed cost-effectiveness ratio, e.g., cost per quality-adjusted life year gained, derived from a robust model that incorporates clinical trial data, real-world evidence on resource utilization, and appropriate discounting for future costs and benefits. Explanation. This scenario presents a professional challenge because it requires a health economics professional to evaluate a new medical intervention using cost-effectiveness analysis, C, within the specific regulatory and ethical framework of the CEBS exam's jurisdiction. The challenge lies in balancing the potential clinical benefits of the intervention against its resource implications, while adhering to established guidelines for evidence appraisal and decision-making in healthcare. Professionals must exercise careful judgment to ensure that the evaluation is robust, transparent, and aligned with the principles of efficient and equitable resource allocation. The correct approach involves conducting a comprehensive cost-effectiveness analysis that considers all relevant costs and health outcomes, using appropriate methodologies and data sources. This approach is justified by the regulatory framework governing health technology assessment, which mandates evidence-based evaluations to inform resource allocation decisions. Specifically, it aligns with the principles of maximizing health gains within budgetary constraints, ensuring that public funds are used efficiently. Ethical considerations also support this approach, as it promotes fairness by ensuring that decisions about which interventions to fund are based on objective evidence of value for money, rather than other factors. An incorrect approach would be to focus solely on the clinical efficacy of the new intervention without adequately considering its costs. This fails to meet the core objective of cost-effectiveness analysis, which is to assess value for money. Ethically, it could lead to the adoption of expensive treatments that offer marginal benefits, potentially diverting resources from other interventions that could provide greater overall health improvements. Another incorrect approach would be to rely on anecdotal evidence or the opinions of key opinion leaders rather than rigorous scientific data. This violates the regulatory requirement for evidence-based decision-making and introduces bias into the evaluation process. Such an approach undermines the credibility of the assessment and could lead to suboptimal resource allocation. A third incorrect approach would be to ignore potential long-term costs or downstream effects of the intervention. A comprehensive CEA must account for the full economic impact of an intervention, including any ongoing management or follow-up care. Failing to do so would present an incomplete and potentially misleading picture of the intervention's true cost-effectiveness. The professional reasoning process for similar situations should involve a systematic review of available evidence, adherence to established CEA methodologies, and transparent reporting of assumptions and limitations. Professionals should engage with relevant stakeholders, including clinicians, policymakers, and patient groups, to ensure that the evaluation is comprehensive and considers diverse perspectives. The ultimate goal is to provide a sound, evidence-based recommendation that supports informed decision-making for the efficient and equitable use of healthcare resources. Question 14. Upon reviewing the financial performance of a large hospital system, senior leadership is seeking strategies to contain escalating operational costs. Which of the following approaches to process optimization is most likely to achieve sustainable cost containment while adhering to U.S. healthcare regulations and ethical standards? Option A. Adopting new electronic health record functionalities primarily based on vendor promises of future cost savings, without comprehensive staff training or workflow integration. Option B. Eliminating certain outpatient services that are perceived as less profitable, without considering community access needs or regulatory mandates for service provision. Option C. Implementing standardized clinical pathways and improving patient flow through departments by reducing wait times and optimizing resource allocation. Option D. Significantly reducing the number of nursing staff across all units without a concurrent assessment of patient acuity and workload. The correct answer is C. Implementing standardized clinical pathways and improving patient flow through departments by reducing wait times and optimizing resource allocation. Explanation: this scenario is professionally challenging because healthcare organizations constantly face pressure to control costs while maintaining quality of care and adhering to regulatory requirements. Process optimization, a key strategy for cost containment, requires a nuanced understanding of operational workflows, patient care pathways, and the economic implications of changes. Professionals must balance efficiency gains with patient safety and regulatory compliance, making careful judgment essential. The correct approach involves systematically analyzing and redesigning healthcare processes to eliminate waste, reduce redundancy, and improve efficiency without compromising patient outcomes. This might include streamlining administrative tasks, optimizing patient flow through departments, or implementing evidence-based clinical pathways. Regulatory justification for this approach stems from the overarching mandate in U.S. healthcare to provide efficient and effective care, often implicitly supported by regulations like the Affordable Care Act, ACA, which encourages value-based care models that inherently require process optimization for cost containment. Ethical considerations also support this approach, as reducing waste can free up resources for direct patient care and improve overall system sustainability. An incorrect approach would be to implement cost-cutting measures that directly reduce staffing levels without a corresponding analysis of workload or patient acuity, potentially leading to burnout and compromised care. This could violate ethical obligations to provide safe patient care and potentially contravene regulations related to staffing ratios or quality of care standards, depending on the specific state and facility. Another incorrect approach would be to implement new technologies or software solutions solely based on their perceived cost-saving potential without adequate training or integration into existing workflows. This could lead to increased errors, decreased productivity, and ultimately higher costs due to rework or patient safety incidents, failing to meet the efficiency goals and potentially creating new compliance risks. A third incorrect approach would be to reduce the scope of services offered without a thorough assessment of community needs or regulatory requirements for essential services. This could lead to patient access issues and potential violations of licensure or accreditation standards. Professionals should employ a decision-making framework that begins with a comprehensive assessment of current processes, identifies areas for improvement through data analysis, and evaluates potential solutions based on their impact on cost, quality, patient safety, and regulatory compliance. This involves stakeholder engagement, pilot testing of changes, and continuous monitoring to ensure sustained benefits and adherence to all applicable laws and ethical principles. Question 15. Stakeholder feedback indicates concerns regarding the rising cost of health insurance premiums for younger, healthier individuals within a group health plan. Some members are advocating for a rating system that more closely reflects the actual healthcare utilization of specific subgroups, arguing it would lead to lower premiums for them. The plan is currently operating under a community rating framework. Which of the following approaches best aligns with the regulatory framework for health insurance rating in this context, considering the need to maintain a stable and accessible insurance pool? Option A. Introducing a voluntary opt-out provision for individuals who believe their healthcare needs are minimal, allowing them to exit the risk pool. Option B. Transitioning to an experience rating system that bases premiums on the claim's history of distinct demographic segments within the group. Option C. Maintaining the current community rating system, which spreads the costs across all members regardless of individual or subgroup claims history. Option D. Implementing a tiered rating system that assigns higher premiums to subgroups with a statistically higher predicted risk of future claims, even if current utilization is low. Correct answer is B. Transitioning to an experience rating system that bases premiums on the claim's history of distinct demographic segments within the group. Explanation. This scenario presents a professional challenge because it requires balancing the financial sustainability of a health insurance plan with principles of fairness and equity for its members. The decision between community rating and experience rating has significant implications for affordability, access to care, and the overall stability of the insurance pool. Careful judgment is required to ensure compliance with regulatory mandates while addressing the diverse needs and concerns of stakeholders. The correct approach involves adhering to community rating principles. This approach is mandated by regulations designed to prevent adverse selection and ensure that individuals with pre-existing conditions, or those who are more likely to utilize healthcare services, are not priced out of coverage. Community rating promotes a broader risk pool, making insurance more accessible and affordable for a wider segment of the population. This aligns with the ethical imperative to provide equitable access to healthcare and is often a legal requirement under specific health insurance legislation aimed at protecting consumers. An incorrect approach would be to solely rely on experience rating without considering the regulatory framework. This approach, which bases premiums on the past claims history of a specific group, can lead to significant premium increases for groups with higher utilization, potentially making coverage unaffordable for them. This can result in adverse selection, where healthier individuals opt out of coverage, leaving a sicker, more expensive pool. Such a practice would likely violate regulations designed to ensure fair pricing and prevent discrimination based on health status. Another incorrect approach would be to implement a hybrid rating system that disproportionately burdens certain demographics without clear regulatory justification. While some flexibility may exist, any deviation from mandated rating structures must be carefully scrutinized for compliance and fairness. Failing to adhere to established rating methodologies or creating systems that unfairly disadvantage specific groups would be a significant regulatory and ethical failure. Professionals should approach this situation by first thoroughly understanding the specific regulatory requirements governing health insurance rating in their jurisdiction. This involves consulting relevant legislation and guidance documents. They should then assess the potential impact of different rating approaches on the affordability, accessibility, and financial stability of the insurance plan, considering the diverse needs of the covered population. A decision-making framework should prioritize regulatory compliance, ethical considerations of fairness and equity, and the long-term sustainability of the insurance product. Engaging with stakeholders to understand their concerns and communicating the rationale behind rating decisions transparently is also crucial. Question 16. Performance analysis shows that a health insurance company is considering leveraging its existing customer database, which contains protected health information, FI, to market new supplemental health insurance products to its current individual market policyholders. What is the most compliant approach under the Health Insurance Portability and Accountability Act, HIPAA, for the insurer to proceed with this marketing initiative? Option A. Utilize de-identified data from the customer database to create marketing lists without seeking individual consent. Option B. Obtain explicit, written authorization from each policyholder specifically for the use of their PHI in marketing the new supplemental health insurance products. Option C. Send marketing materials for the new supplemental products to policyholders, relying on a broad interpretation of permissible communications related to health benefits. Option D. Send marketing materials for the new supplemental products to all policyholders, assuming that enrollment in a health plan implies consent for all communications. The correct answer is D. Send marketing materials for the new supplemental products to all policyholders, assuming that enrollment in a health plan implies consent for all communications. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of the Health Insurance Portability and Accountability Act, HIPAA, and its implications for the individual health insurance market, specifically concerning the disclosure of protected health information, FI, for marketing purposes. The challenge lies in balancing the insurer's desire to market new products with the stringent privacy protections afforded to individuals under HIPAA. Careful judgment is required to ensure compliance without unduly hindering legitimate business activities. The correct approach involves obtaining explicit, written authorization from individuals before using their PHI for marketing purposes. This aligns directly with HIPAA privacy rule, which mandates that covered entities obtain such authorization for most marketing communications that involve PHI. The authorization must be specific, clearly stating what information will be used, for what purpose marketing, and by whom. This approach upholds the individual's right to control their health information and ensures transparency and consent, which are fundamental ethical and regulatory principles. An incorrect approach would be to assume that general consent for enrollment in a health plan implicitly covers marketing of other products. This fails to meet the specific authorization requirements of HIPAA. The privacy rule distinguishes between communications related to treatment, payment, or healthcare operations and marketing. Without explicit authorization, using PHI for marketing is a violation. Another incorrect approach would be to rely on a safe harbor exception for marketing without verifying if the criteria are met. For example, sending marketing materials without authorization based on a vague understanding of permissible communications would be a violation. The safe harbor requires that the communication be about a health-related product or service that is part of a health plan, and the communication is about the plan itself or health benefits. Simply marketing unrelated products or services, even if health-related without specific authorization, would not qualify. A further incorrect approach would be to de-identify the PHI before using it for marketing. While de-identification is a permissible way to use health information for certain purposes, the process must meet strict HIPAA standards for de-identification. If the de-identification is not performed correctly, the information may still be considered PHI, and its use for marketing without authorization would be a violation. Professionals should adopt a decision-making framework that prioritizes understanding and adhering to specific regulatory requirements. This involves 1. Identifying the relevant regulations, HIPAA in this case. 2. Analyzing the specific action contemplated marketing using PHI. 3. Determining if the action falls under a permissible use or disclosure, or if specific authorization is required. 4. If authorization is needed, ensuring it is obtained in the correct format and with the necessary specificity. 5. Consulting with legal or compliance experts when in doubt. Question 17. Implementation of widespread telehealth services for chronic disease management presents a complex challenge for healthcare expenditure forecasting. Which approach best assesses the potential impact on overall healthcare expenditures? Option A. Conducting a detailed analysis of the potential for reduced hospitalizations and emergency room visits, alongside an evaluation of new technology acquisition costs and potential increases in routine virtual consultations. Option B. Focusing exclusively on the initial capital investment required for telehealth infrastructure and assuming all new technology inherently drives up long-term costs. Option C. Prioritizing the immediate reduction of in-person physician visits without a comprehensive analysis of the downstream effects on patient care and potential for increased specialist referrals. Option D. Estimating expenditure trends based solely on the projected adoption rate of telehealth by a small segment of the patient population, ignoring broader systemic impacts. The correct answer is A. Conducting a detailed analysis of the potential for reduced hospitalizations and emergency room visits, alongside an evaluation of new technology acquisition costs and potential increases in routine virtual consultations. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how emerging healthcare delivery models can impact overall expenditures, necessitating a forward-looking risk assessment that aligns with regulatory expectations for financial stewardship. Professionals must balance innovation with the imperative to control costs and ensure the sustainability of healthcare systems, all within the framework of applicable regulations. The correct approach involves a comprehensive analysis of how the implementation of telehealth services, particularly for chronic disease management, could lead to both cost saving through reduced hospitalizations and emergency room visits, and potential cost increases due to new technology investments and increased utilization. This approach is correct because it acknowledges the dual nature of expenditure trends and aligns with regulatory guidance that emphasizes proactive risk management and evidence-based decision-making in healthcare economics. It requires a thorough assessment of potential return on investment and the identification of key performance indicators to monitor actual expenditure trends post-implementation, ensuring alignment with the goals of the Healthcare Economics and Issues Exam, CEBS, which focuses on understanding the economic drivers and challenges within healthcare. An incorrect approach would be to solely focus on the initial capital investment required for telehealth infrastructure, without considering the potential long-term savings. This fails to meet regulatory expectations for a holistic financial assessment and ignores the potential for expenditure reduction through improved patient outcomes and preventative care facilitated by telehealth. Another incorrect approach would be to assume that any new technology will automatically increase expenditures without a data-driven analysis of its impact on utilization patterns and patient management. This overlooks the potential for efficiency gains and cost containment that innovative solutions can offer, and thus fails to engage in the comprehensive risk assessment mandated by sound economic principles in healthcare. A third incorrect approach would be to disregard the impact of patient adoption rates on expenditure trends, assuming a fixed utilization pattern regardless of how readily patients embrace the new technology. This neglects a critical variable in expenditure forecasting and risk assessment, as actual utilization directly influences both cost and potential savings. Professionals should employ a decision-making framework that begins with identifying the core objective, e.g., improving chronic disease management while controlling costs. This is followed by a thorough environmental scan to understand current expenditure trends and the potential impact of emerging solutions like telehealth. A robust risk assessment should then be conducted, considering both potential cost increases and savings, supported by data and evidence. Finally, a monitoring and evaluation plan should be established to track actual expenditure trends and adjust strategies as needed, ensuring ongoing alignment with regulatory and organizational goals. Question 18. Which approach would be most appropriate for evaluating a new healthcare intervention, considering the structure, process, and outcome measures from a broad stakeholder perspective within the regulatory framework of the CEBS exam. Option A. An evaluation that solely focuses on the clinical effectiveness of the intervention, as measured by statistically significant improvements in patient health indicators. Option B. An evaluation that prioritizes the reduction of healthcare costs associated with the intervention, regardless of its impact on patient outcomes or process efficiency. Option C. A comprehensive evaluation that integrates measures of healthcare system organization, service delivery efficiency, and patient health status and satisfaction, informed by the specific regulatory requirements for health economics and outcomes assessment. Option D. An evaluation that exclusively considers the perspective of the healthcare providers delivering the intervention, focusing on ease of implementation and workflow integration. The correct answer is C. A comprehensive evaluation that integrates measures of healthcare system organization, service delivery efficiency, and patient health status and satisfaction, informed by the specific regulatory requirements for health economics and outcomes assessment. Explanation. This scenario is professionally challenging because it requires balancing the diverse and often competing interests of various stakeholders within the healthcare system, while adhering to specific regulatory frameworks governing health economics and outcomes. The CEBS exam focuses on understanding these dynamics within a defined jurisdiction, necessitating a precise application of relevant laws and guidelines. Professionals must navigate the complexities of measuring healthcare value, ensuring that proposed interventions not only demonstrate clinical effectiveness, but also economic viability and patient benefit, all within the established regulatory landscape. The correct approach involves a comprehensive stakeholder perspective that integrates structure, process, and outcome measures. This approach is professionally sound because it aligns with the principles of value-based healthcare, which is increasingly emphasized in regulatory frameworks. By considering how the healthcare system is organized, structure, how services are delivered, process, and the ultimate impact on patient health and satisfaction, outcomes, stakeholders can gain a holistic understanding of an intervention's worth. This comprehensive view is crucial for informed decision-making, resource allocation, and ensuring that interventions meet the multifaceted objectives of the healthcare system as defined by its governing regulations. For instance, regulatory bodies often mandate the reporting of specific outcome metrics and may require evidence of efficient processes to justify reimbursement or adoption of new technologies. An approach that solely focuses on clinical efficacy without considering economic implications or patient experience would be professionally unacceptable. This failure stems from a disregard for the economic realities of healthcare provision and the regulatory requirement to demonstrate value for money. Such a narrow focus ignores the broader mandate of health economics to optimize resource allocation and achieve population health goals. Similarly, an approach that prioritizes cost reduction above all else, neglecting clinical effectiveness and patient outcomes, is also professionally flawed. This violates ethical principles of patient care and can lead to non-compliance with regulations that mandate a certain standard of care and patient well-being. Healthcare is not solely an economic transaction. It is a service with profound ethical and social implications, and regulatory frameworks reflect this. An approach that only considers the perspective of a single stakeholder group, such as providers or payers, without broader consultation or consideration of other affected parties, is also problematic. This can lead to biased assessments and decisions that do not serve the overall public interest or comply with regulations that promote equity and access. Professional decision-making in healthcare economics requires a balanced and inclusive perspective, informed by a thorough understanding of the relevant regulatory environment and its objectives. The professional decision-making process for similar situations should involve 1. Identifying all relevant stakeholders and their interests. 2. Understanding the specific regulatory framework and its requirements for measuring structure, process, and outcomes. 3. Gathering data that addresses all three dimensions of measurement from a stakeholder-informed perspective. 4. Analyzing the data to assess the overall value and impact of the intervention, considering both economic and non-economic factors. 5. Communicating findings transparently and ethically to all stakeholders, ensuring compliance with reporting requirements. Question 19. The analysis reveals that a patient's physician has requested authorization for a specialized, high-cost treatment that is not explicitly covered by the payer's standard utilization management criteria. The physician strongly believes this treatment is medically necessary for the patient's unique condition and has provided a detailed clinical rationale. However, the initial review by the utilization management team has flagged the request for denial due to a lack of alignment with established protocols. What is the most ethically and regulatorily sound course of action for the utilization management professional? Option A. Escalate the case for a peer-to-peer review with the treating physician and a medical director from the payer, providing all supporting clinical documentation for further evaluation of medical necessity. Option B. Approve the treatment without further review to avoid potential patient dissatisfaction and legal challenges. Option C. Immediately uphold the denial based on the initial reviews finding that the treatment does not meet standard criteria. Option D. Advise the patient to seek alternative, less expensive treatments that are covered by the payer's criteria, regardless of the physician's recommendation. The correct answer is C. Immediately uphold the denial based on the initial reviews finding that the treatment does not meet standard criteria. Explanation. This scenario presents a significant ethical dilemma for a utilization management professional within the U.S. healthcare system, specifically concerning the balance between cost containment and patient well-being. The challenge lies in navigating the gray area where a treatment, while potentially beneficial, is deemed not medically necessary by the payer's strict criteria, leading to denial. The professional must uphold their fiduciary duty to the payer while also considering the ethical obligation to advocate for patient care, especially when the patient's physician strongly supports the treatment. This requires a deep understanding of both regulatory requirements and ethical principles governing healthcare. The correct approach involves a thorough review of the patient's medical record, consultation with the treating physician to gather further clinical justification, and a careful assessment of whether the payer's criteria are being applied appropriately given the unique clinical circumstances. If the evidence strongly supports the medical necessity of the treatment, even if it falls outside the standard criteria, professionals should escalate the case for further review or initiate an appeal process. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and the regulatory framework that often allows for exceptions based on individual patient needs, as well as the patient's right to a fair review process. The Health Insurance Portability and Accountability Act, HIPAA, also mandates appropriate handling of patient information during such reviews. An incorrect approach would be to immediately uphold the denial solely based on the initial interpretation of the payer's criteria without further investigation. This fails to acknowledge the potential for individual patient variation and the importance of physician judgment. Ethically, this prioritizes cost savings over patient welfare, violating the principle of beneficence. From a regulatory standpoint, it may contravene provisions within the Affordable Care Act, ACA, that aim to protect patients from arbitrary denials and ensure access to necessary care. Another incorrect approach would be to bypass the payer's established review process and immediately approve the treatment without proper documentation or justification. This undermines the utilization management function, potentially leading to financial losses for the payer and setting a precedent for future inappropriate approvals. It also fails to adhere to the contractual obligations between the provider and the payer. A third incorrect approach would be to dismiss the treating physician's opinion as biased and refuse to consider their input. This demonstrates a lack of respect for the physician-patient relationship and the clinical expertise of the treating provider. Ethically, it can be seen as paternalistic and may lead to suboptimal patient care. The professional decision-making process in such situations should involve a structured approach. First, thoroughly understand the payer's utilization management criteria and the patient's clinical presentation. Second, engage in open communication with the treating physician to gather all relevant clinical information and understand their rationale. Third, critically evaluate the evidence against the established criteria, considering any unique patient factors. Fourth, if there is a strong clinical argument for medical necessity that deviates from standard criteria, explore internal appeal mechanisms or escalate the case for a peer-to-peer review. Finally, ensure all actions are documented meticulously and comply with all applicable federal and state regulations, including those related to patient privacy and appeals processes. Question 20. Strategic planning requires a comprehensive understanding of international healthcare cost variations. Which of the following analytical approaches would best inform effective policy development and resource allocation by providing a robust and contextually relevant comparison of healthcare expenditures across different nations? Option A. Examining the structural differences in healthcare financing mechanisms, service delivery models, and the impact of national health policies on overall expenditure. Option B. Equating higher healthcare spending in one country directly with superior health outcomes compared to countries with lower spending. Option C. Comparing per capita healthcare spending figures across countries without adjusting for differences in gross domestic product, GDP, or population age demographics. Option D. Analyzing the proportion of healthcare spending dedicated to administrative overhead in each country, assuming this is the primary driver of cost differentials. The correct answer is C. Comparing per capita healthcare spending figures across countries without adjusting for differences in gross domestic product, GDP, or population age demographics. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a nuanced understanding of how different national healthcare systems are structured and funded, and how these structures impact overall cost. Professionals must navigate the complexities of varying regulatory environments, economic factors, and societal priorities that contribute to healthcare expenditure. Making informed strategic decisions necessitates moving beyond superficial comparisons to a deeper analysis of the underlying systemic drivers of cost. Correct approach analysis. The correct approach involves analyzing the structural differences in healthcare delivery and financing mechanisms across countries. This includes examining the role of government versus private insurance, the extent of price regulation for services and pharmaceuticals, and the impact of population demographics and disease prevalence. For instance, a country with a single-payer system might have greater leverage in negotiating drug prices, leading to lower pharmaceutical costs compared to a multi-payer system. Similarly, the emphasis on preventative care versus acute care can significantly influence overall spending. This approach is justified by the need for accurate, context-specific insights that inform effective policy and resource allocation, aligning with the CEBS exam's focus on understanding the economic realities of healthcare. Incorrect approach is analysis. Focusing solely on per capita healthcare spending without considering the underlying economic and demographic factors is an incomplete and potentially misleading approach. This fails to account for differences in wealth, age distribution, and the burden of chronic diseases, which are significant drivers of healthcare costs. Such a superficial comparison can lead to flawed strategic planning. Another incorrect approach is to assume that higher spending automatically equates to better health outcomes. While there can be a correlation, it is not always linear. Countries with lower spending may achieve comparable or even superior outcomes through more efficient resource utilization, effective public health initiatives, or different societal values regarding healthcare. Ignoring this nuance can lead to misallocation of resources and ineffective policy interventions. A third incorrect approach is to attribute cost differences solely to administrative inefficiencies without a thorough investigation. While administrative costs are a component of healthcare spending, they are not the sole determinant. Differences in the complexity of regulatory environments, the scope of services covered, and the level of technological adoption also play crucial roles. Overemphasizing administrative costs can distract from addressing more fundamental systemic drivers of expenditure. Professional reasoning. Professionals should adopt a systematic, multifaceted approach to international healthcare cost comparisons. This involves 1. Defining the scope of the comparison, what specific cost components are being analyzed, e.g., pharmaceuticals, hospital care, primary care. 2. Identifying key contextual factors. What are the relevant demographic, economic, and regulatory differences between the countries being compared? 3. Utilizing reliable data sources. Employing data from reputable international organizations, e.g., OECD, that provide standardized metrics. 4. Analyzing systemic drivers. Investigating the underlying reasons for cost variations, such as financing models, provider payment mechanisms, and policy choices. 5. Drawing conclusions cautiously. Recognizing that direct comparisons can be challenging and that findings should be interpreted within their specific national contexts.